And now it's your turn to get free advice from the dentist. Dr. Mark Hyman is here to answer your questions about family and cosmetic dentistry. The number to call, 1-800-807-8255. Good morning.
Good morning, Cindy.
Good to see you.
Nice to be back.
Let's go to the phone lines where we have Levon waiting from Greensboro. Good morning, Levon. What's your question?
My question is, I would like to know what causes a lot of swelling on your gums, if you don't wear dentures, would that cause a lot of swelling in them?
Levon, for someone that's wearing dentures and you're not wearing them, there's a swelling in the gum, that does concern me. When I was at Chapel Hill, what they taught us is lumps and bumps belong in bottles, not on people. So if you've got a swelling that's painful, if it's changing size or shape or color, you really ought to have your dentist look at it and evaluate it. It certainly could be something simple, it could be something more complicated. And what we ask folks is when there's a change in their mouth, the sooner you get it checked out, the better. And I wish you well.
Let's go to Melody, who's also in Greensboro with a question. Good morning, Melody.
Good morning. My question is, I had a...
Go ahead.
Good morning.
Hi.
My question is that I had a tooth pulled.
Hey, Melody, your TV must be turned on, and that's what's kind of confusing you. Go ahead and just state your question. Try not to listen to the TV.
Okay.
Go ahead.
My question is, I had a tooth pulled about a week ago, and they stitched the gums, and the stitching came out the same day. And if they, I went the next day, and he said I didn't require the stitching, but the hole is still there. Not a lot of pain, but a lot of discomfort. Should I go back and require that they stitch the gum?
Right. Melly, I'm sorry that you had the tooth taken out. It's not unusual for stitches to come out early. When that happens, you're still going to heal. It just may take longer. If you think about it, when you had a tooth in the gum and the bone and that is all gone, it's going to take a full month, several months to heal in completely. If you've got pain, that could be what's called a dry socket, which can happen 3 to 5 days after a tooth is pulled, usually from losing the healthy blood clot. So I would rinse vigorously with salt water. I would certainly call my dentist and ask him or her, do they want to see you? Do they want to take an x-ray? Perhaps re-clean out the socket. There's some medication that they can pack in there and help you heal faster. But you need to expect that it's going to be a good month to several months before that area fills in completely.
Let's get to Laverne in High Point. Good morning, Laverne.
Good morning.
Hi.
Doctor, I have several loose teeth in my mouth,
Yes.
and I have gum disease. I'm trying to determine what's my best option. Should I look at veneers? Should I look at, what do you call them, dentures? Or should I look at implants? And what's the difference?
Right. When teeth are loose like that, first we absolutely want to try to treat the gum disease. About 90% of adults have some level of gum disease, so that's not unusual. But for the teeth to be loose, it's really showtime. You need to get seen as soon as possible and get a game plan, get a roadmap for getting healthy. So by brushing, by flossing, perhaps some deep cleaning, your dentist and hygienist can tell you what's appropriate. We can get the foundation solid in your mouth. Then they can talk about what's the appropriate treatment for you. Is it something cosmetic like veneers that you mentioned? Or is it time to take some teeth out and consider either dental implants or bridge work or a prosthetic device that comes in and out of your mouth? So the gum disease is paramount that you jump on that as soon as possible and celebrate the healthy teeth that you still have and commit to keep those the rest of your life.
One thing that we like about Dr. Hyman is that when he comes in, he always brings something to show us some of the latest technology. And this deals with crowns, right?
It does, Cindy. In a traditional way, when somebody's got a broken tooth or multiple teeth, old fillings from trauma, a crown is a prosthetic device that'll secure the tooth, wrap around it. The traditional way to solve that is you have an impression after the teeth are prepared, put in a temporary that you'll wear about 3 weeks, then it comes back from the lab. That's the way it's always been done in dentistry. What we now do in the Fox Family Viewing area, there are many dentists who have CAD/CAM dentistry. That's computer aid design, computer aid milling, where you take a solid block of feldspathic porcelain or a plastic material, whatever's appropriate for the patient, put it into the CAD/CAM machine, and in about 6 to 8 minutes, the crown is made.
Wow.
So instead of 3 weeks, we can have the tooth back in 8 minutes. So there's no impression, no temporary, no second visit. It's really amazing, and one of my heroes in dentistry predicted in 5 years we won't even take impressions anymore in dentistry.
Really?
For dentures, for orthodontics, for bite splints, for snore guards that will just scan the mouth with these CAD/CAM machines.
Wow.
So it's really cool.
That is very interesting. Thank you. Good to see you.
It's good to be back.